I was traveling with my friend and we were having some fun. And I landed over a stone while I jumped in a very awkward position. I felt a pop sound at that time. I felt maybe I had a fracture. But eventually, after a weeks, when my swelling reduced and I had an MRI, I found out that it was not my bone which was a problem, it was the ACL, the ligament of my right knee had broken. Finally, when I came from Beijing to Bangalore, we searched through a lot of doctors in different cities. Finally, we figured it out that Dr. Narayan Hulse was one of the specialists in such surgeries of the knee.
Dr. Gourav Jha had an injury called ACL injury. These injuries are very common ligament injuries. They happen mainly because of sports injuries, especially in the Western countries. However, major injuries like Dr. Gourav Jha, we have to do something called arthroscopic or a keyhole reconstruction of these ligaments. These ligaments are reconstructed using our own body tissue called hamstring or tendon grafts. These operations are keyhole operations, and these operations are done using an advanced technology called keyhole surgery using arthroscopic machines. We make only a very small tiny 2.5 to 3 mm cuts on both sides of the knee to reach the knee, and through these incisions we use fiber optic lens and fiber optic camera to visualize them on the monitor. Because of these small incision, tissue damage is very less, and that's why these people rehabilitate very quickly.
When we understood that there are two kinds of procedures which we can actually follow having the ACL surgery, and I probably chose the hamstring way to go for it. It was a very simple procedure, not a much difficult one, and I had to stay at Fortis Hospital only for a day and 1 day for my follow-up. In the operation theatre, I was awake while I was being asked all different types of questions by Dr. Narayan Hulse, making it easier for me to have the surgery.
So Dr. Gourav Jha did very well after his surgery. He is back on his feet and he is able to do almost all normal activities as well as sports. He tells to me that he's recently graduated from his MBBS and he is able to participate in cricket and football.
Within a month, I was able to resume almost all my activities. I could walk properly, walk fast properly, run properly, and I could do all my daily activities which I could have been doing with my ACL in the proper place. And when I visited him after a month, he was really surprised to see that I was doing really well than most of the other patients.
If anybody has been diagnosed with an ACL injury or a similar injury like Dr. Gourav Jha, get them examined by a qualified orthopedic surgeon. It's important that we assess them and make proper treatment for these kind of conditions in the joint, so that that will not lead to further damage to your knee in the future.
Lastly, I would like to thank Fortis Bannerghatta for giving me the opportunity and the facilities that I have availed being treated over there. They have been very good and kind with the procedures and everything. Even the counseling which they provide with what kind of facilities we can avail at Fortis has been at its best. So thank you, Fortis.